Okay, BSI, PPE, is my scene safe? Scene safe. Number of patients is 1. Additional resources, I'll probably call for ASL backup. Nature of injury, and C-spine consideration, doesn't look like you need C-spine because he's sitting upright. I'm gonna go ahead and get a general impression of my patient as I approach. As I come forward, it seems like he's clutching his chest and he's in pain. Looks to be about 18 years old. So I'll go ahead and determine level of consciousness using AVPU. Hello, sir. My name's Beth, and I'm with Edgewood Ambulance.
Hi.
Just making eye contact. What's your name?
Charlie.
Charlie. Can you tell me where we are?
We're in the ambulance shed.
Okay, and can you tell me why I'm here today?
I'm having pain in my chest, and it kind of radiates down my arm.
Okay, and do you know what day of week it is?
It's Saturday.
Okay, so the patient is alert and he's verbal, alert and oriented times 4, answered 4 of my questions. So I'm going to go ahead and state my general impression, or chief complaint, which is chest pain, and then I'm going to go ahead and assess and treat all life threats, starting with airway, which I already know is open, patent, because he's talking in full sentences. His breathing, I'm going to go ahead and get rate rhythm and quality of his respirations. Okay, so his respiration rate is about 24. And then I'm going to go ahead and check his breathing. I already did that. Nope, did I? Nope. Wait. Sorry. Okay, airway, breathing, and I'm going to go ahead and get pulse. So this is circulation. He's not bleeding anywhere. I'll go ahead and get his pulse. Okay, so his pulse is 115. I'm going to check out his skin condition. It's cool, clammy, and pale. So I'm going to go ahead and put a blanket on him. And because his respiration is a little speedy, I'm going to go ahead and put him on 100% oxygen at 15 milliliters with a non-rebreather mask. And then I'm going to go ahead and determine priority. I'd say he's a high priority patient, and I'm going to arrange for ALS intercept right away. Then I'm going to fall into some history questions, starting with OP, QRST questions, and then follow up with sample. So can you tell me when this first began, your pain first began?
Probably about 2 hours ago.
About 2 hours ago, okay. And then, is there anything you do that makes it better or worse?
Nothing makes it better, and when I move around, it makes it worse.
Okay. And can you describe your pain for me?
It's more of like a sharp stabbing pain.
Okay, right about in the center of your chest or off to the side?
Off to the side, left
side. Okay. Okay. And then does it radiate? You said it radiates down your left arm. Does it go anywhere else?
No, just left arm.
Okay. And then on a scale from 1 to 10, with 10 being the worst pain, how would you rate your pain?
Probably 9.
9, okay, 9 out of 10. So, again, about how long ago did this start?
About 2 hours ago.
2 hours ago, okay. And then you said your signs and symptoms are chest pain, radiating down your left arm, feeling nauseous at all?
A little bit.
Dizzy?
Yeah.
Okay. Are you allergic to anything?
No.
No allergies? Okay. And are you taking any prescription medication?
No.
Are you taking any over-the-counter medication?
No.
Okay, no prescriptions?
Nope.
No nitro or aspirin?
Yeah, I actually do have nitro and aspirin. I forgot to tell you that.
Oh, okay. So that's good to know. So, Any over-the-counter, you said no?
No.
Any natural remedies, anything like that?
No.
Okay. Okay, so, so do you have a past medical history of heart condition, any angina in your
Yeah.
past?
I had a heart attack 2 years ago.
Okay, so you had a heart attack 2 years ago and you've been prescribed nitro and baby aspirin,
Mm-hmm.
right?
Yep.
Okay, so the events leading up to this.
Yep.
You were doing what when this happened?
I was mowing my lawn.
Mowing? Okay, were you on a rider or push mowing?
Push mower.
Okay, so you maybe exerted yourself. Okay, so then I'm gonna go ahead and do a focused physical exam on his cardio and pulmonary, and I'm also gonna check integumentary, GI. Yeah, okay, so I'm gonna go ahead and listen to your heartbeat. Alright, oops, like that. And then, do you care if I push on this?
Mm-hmm.
Does it hurt when I do that?
Yeah, a little bit.
Okay, just right off to the side.
Yeah.
Okay. So then I'm gonna go ahead and listen for lung sounds, crackles, rales, bronchi. Oops, in the back, right? Okay, so your lung sounds clear. I'm gonna go ahead and get respiratory rate again. Okay, you're still about 24. And then go ahead and look at your skin one more time. It's still pale, cool, and clammy. You're not bleeding. I'm gonna take your pulse. And it's still a bit high, but 115 still. And do you have a history of GI bleeding? No. Okay. So let's see. What am I missing here? Okay, we'll keep going. Okay, so I'm gonna go ahead and get a set of vitals, starting with blood pressure. Put blood pressure cuff on you and listen to that. So I've got 140/80, so it's a little high. Your pulse. I just did this, but I'll do it again. And then your respiratory rate. I'm gonna go ahead and put an oximeter on your finger. And then I'm gonna go ahead and check your pupils for equal size, and then shine a light in, see if they dilate, reactivity. Okay, and then I'm going to state my field impression. My field impression is that you may be having another heart attack, and I'm going to go ahead and go over your medication, 5 patient rights, and then call medical control for permission to administer. Okay, so you've got your nitro there?
Yep.
Okay, so are you Charlie Andrews, and is this your medication?
Yep.
Okay, and so it says 4 81 milligram tablets orally as needed for chest pain. So this is the right time, right patient, right dose, right route, right medication. Nitro, and it's not expired. Nitro, same thing, Charlie Andrews for chest pain. Right patient, right medication, right dose, 0.4 milligrams, and it's sublingual as needed. And then, yeah, okay. So then, do you take any erectile dysfunction medication?
No.
And then your blood pressure is okay, so there's no contraindications. Okay. So I'm gonna go ahead and call medical control. This is Beth Andrews, Unit 6218 from Edgeley Ambulance Service. I have an 18-year-old male with chest pain radiating down his left shoulder, his left arm. He was push mowing 2 hours ago, and his last oral intake was this morning. He had eggs for breakfast, hasn't had anything since then. He has no allergies. He's got a prescription here for nitro and for baby aspirin. No contraindications, not allergic. Do you have any GI bleeds? Forgot to ask that.
No.
Okay, no GI bleeds, and his blood pressure is over 100. So, can I have permission to administer? Yes, okay, so go ahead and take these 4 baby aspirin, chew them up. Okay, and then the nitro goes under your pill, under your tongue, let it dissolve, don't chew it. Alright?
Okay.
And then I'm gonna go ahead and reassess every 5 minutes and route to the hospital. Get more vital signs on the way, and then I'm going to give a full verbal report to the EMS, the ALS transmit, or ALS, what's the word?
Intercept.
Intercept, or the emergency room doctor.
Okay.
So,